Here are five things your gynecologist wants you to know.
Ovaries don't grow new eggs.
The ovary comes as a fixed package. Regardless of your race, every female baby is born with a fixed number of eggs. 1 to 2 million eggs are available in the ovary at birth. And by the time a woman gets to puberty, even less than 1% of that would eventually be ovulated. This means that a woman cannot grow new eggs in her lifetime. As of today, there is no supplement or medication that can regenerate or grow fresh eggs for a woman.
Your period can naturally change.
The pattern of a woman's menses or her period changes as she ages. The cycle length may increase. The cycle length is the number of days from one period to the next. So the length may increase or in some instances may even decrease. And then the flow, number of days it flows may also reduce, which means that you may have a situation whereby you used to have a period for 4 days and 5 days, and all of a sudden it's now 3 days and 2 days. But the cycle length increases from maybe 27 days, 28 days, it's now 30 days, 31 days, 32 days. This is because the quality of the eggs are reducing as women gets to her 30s and 40s, and even the hormonal environment is also responding to that change.
Fertility, male or female. Infertility is a man and a woman problem. Men contribute as much as women to the concept of infertility. So male factor infertility, which is how we describe infertility that is due to suboptimal characteristics of the semen, can contribute 30 to 40% of cases of infertility. In the same vein, for the females, it can also contribute 30 to 40% of infertility. So you see why a couple, a man and a woman, should get evaluated for infertility, and not just the woman alone or not just the man alone. Fibroids and getting pregnant. There is no consistent relationship between uterine fibroids and infertility. That a woman has uterine fibroid alone may not explain why she is not getting pregnant, because we have found that there are women that will have fibroids even sitting right inside the cavity of their wombs, and they will get pregnant, while some others will have that same size of fibroids and would not get pregnant. Some others may have fibroids as big as even getting up to the chest and will not get pregnant. Some others will have same and get pregnant. So there is no consistent relationship between fibroids and infertility. But if you're going to go for a procedure like assisted reproduction, IVF, or every other thing has been ruled out as a cause for infertility, it is worth trying to have a fibroid surgery done, but it does not guarantee success of conception. Bleeding after menopause. When a woman has reached menopause, that is, you have stayed up to, you've stopped seeing your period, that's not to a year, you're in your 40s, you're not pregnant, 50s, you're not pregnant, you stayed up to a year, no periods. If you ever see blood again coming through your vagina, please don't wait it out. Don't try to observe, oh, let me see what this is really about. No, you need to have that checked out. You need to see a gynecologist most especially. But if you're in a setting where you cannot see a gynecologist directly, then you can see the general practice physician or a general practitioner who should refer you appropriately to a gynecologist. But that needs to be checked out. It's not something you want to observe and just watch and see how it goes. All right, that needs to be checked out. After menopause, that area should be quiet. But if it's called into active service again, we need to know why. Now here's a bonus point: do a pap smear.